Okay, you can get up and walk to the door. And please come back and walk to the chair. Today's date's March 24th, and we're here with Ruth, who came from Oregon. Ruth, do I have your permission to make a video of you and post you on YouTube?
Yes.
Thank you. Your niece is in the background. You don't have any issue either, do you? Thank you very much. And you're here for knee issues, correct? You have serious knee degeneration. The doctors want to operate and replace your knees. Is that correct?
Yes.
And the x-rays showed what's called medial compartment. In other words, the inside of your knees on the inside are essentially collapsed.
Yes.
And we're going to see what we can do about helping that. Okay? You also have an issue with your body, and we've discussed that as well. I've given you some hints and pointers on what to eat, how to eat, and the psychology of eating. Have I hit at least a single or a double with you?
You have.
Okay, thank you. Is it going?
Yes.
Okay, so for starters, her knee is big, bigger than I'd like, so that says there's arthritis. And I think you can also see the contour of the leg. There's a lot of extra tissue here that needs to be lost for better function of her whole body. So now we're just going to go through a range of motion. And this is as far as her knee can go before she has pain. That's about 90 degrees. And we're going to check this knee too. That's a little bit more than 90 degrees. You can stop it, thank you. And that was painful to you, wasn't it, when we went to the edge, correct? Okay. Her knees, and we're going to check range of motion. Relax. We'll bring your leg up, and now we're going to bend this knee. Didn't that hurt you before?
Yeah.
Look, we got more than 90 degrees here. And we got more than 90 degrees here too. Okay, now I'll take that. So we just did your knees, and I'm going to ask you to get off of there and walk to the door, please.
Wow.
What?
Wow. Wow.
Okay, you want to sit down?
Yeah. Oh.
And now, can you get up and walk to the door? That was a lot easier. What? Oh, wow.
Yeah.
She's scurrying around, huh?
Oh, yeah.
That's
great. I
You
don't.
can even lift up your legs, huh?
Yeah. This is great.
You couldn't do that before. You're standing on one leg. So let me tell you what just happened. That tells me I got the right spot because you're not in pain. I put a local anesthetic in. So I got the right spot. And this part of this right now could be a local anesthetic effect, which wears off very, very quickly. However, the ozone got into the right spot too. And ozone goes to work immediately, lowering inflammation and enabling tissue repair. So this is a very good sign. And I'd like to video you again before you leave the office to see what happens, and that's after the local anesthetic wears off, okay?
Okay.
So this is a good sign, and you're happy.
I'm happy.
Surprised?
Yes.
You're
Yeah.
surprised as well?
I'm happily surprised.
Okay, very good. Thank you.
Thank you.
You came in telling me the back of your knee was hurting.
Yeah, I don't feel it. It doesn't hurt.
Surprised?
Yes.
Okay. Okay, the local anesthetic should have worn off by now. Let's see you get up and walk to the door. Not bad. And you got a smile on your face.
Yes.
And I think I also heard you say that you could go back to Oregon with your leg like it is.
Yes.
Without the pain, because you told me coming down here it really hurt.
Mm-hmm.
Okay, thank you. Today's date is March 24th, 2022. This is Lydia. And her daughter's in the background, and she's already given me permission to have her on video. And you're here from Oregon with a variety of things.
Yeah.
And I just saw you having a lot of trouble getting off of that chair. That's what I want to capture.
Yeah.
Walk to the door.
I always have to use my arms.
Okay, go to the door. And go back to the chair. Now, what was hurting getting off?
My knees.
Your knees hurt?
Uh-huh.
Okay. Thank you. What we have here is where squamous cell cancer was removed, and it's never healed right. And I'm not taking any responsibility for the absence or presence of cancer. Your dermatologist is, but we will inject that with ozone, and I'm going to give you topical ozone oil to put on. All they do is they give you steroids. You have swelling in your leg, which is not healthy, and your leg, bend it please, bend it as far as you can, barely 90 degrees. And now we're going to bend this one as far as you can, just a tiny bit more than 90 degrees. So there's significant arthritis in your knees. Okay, you can stop. Okay, Lydia, we just did your knees, and we did your wound here. And I'm going to have you get up in a moment. You can get up now. I'd like to see you walk to the door. Now go back and sit on your chair, please.
Wow, it didn't hurt.
What?
It didn't hurt.
All right, let's see you get up and walk to the door.
Oh my goodness.
No struggle there.
How long will this treatment last?
You like it?
Yeah,
Was it worth the trip?
of course.
Okay, you can sit back down.
Oh my goodness.
I'll tell you the same thing I told your sister-in-law. You pay me to get the right spot. I did, because the pain's gone. The local anesthetic does take away the pain, but the local anesthetic doesn't last long.
Yeah.
It goes away very quickly. Ozone kicks in almost immediately. And it reduces inflammation, provides oxygen for healing, and some pain may come back, all of it might come back. You might need repeated treatments. There's no way to know how many you're going to need.
Yeah.
None of it may come back. I never know.
Each patient is individual.
Each patient's individual. Some patients don't come back for years, 3-4 years with one treatment. And I won't know until you let me know. But the fact is, you had a good response, so I expect to have a long-term good response with ozone to your knee.
It felt like when I was younger.
Isn't that? Let's see you get up
No
again.
pain.
No pain. Wow.
I can't believe that. I mean, I do, but you know what I mean.
Yeah.
I wasn't expecting that.
I expect it, but I don't tell you.
Yeah, of course.
I can't. Okay, thanks. And thank you for giving me permission to put you up on
You're
YouTube.
welcome. You're welcome.
So it's been a few hours since we did your knees, and I'd like to see, the local anesthetic is long worn off. Let's see how you get up and walk. And go back. I would say that's dramatically better than when you walked in the door.
Mm-hmm. Yes, I
Thank
would say
you.
that.
So it's been a couple hours since we did you. That local anesthetic is long worn off, and I'd like to see you get up and walk.
Okay. Which direction?
And then back to the chair. What do you say?
Thank you. I feel lighter in my joints.
Good. Okay. This goes to show the viewer, I did you and one of your relatives today, and it's lasted beyond the duration of a short-acting local anesthetic.
Right.
And what it goes to show is the ozone kicks in as a natural healing anti-inflammatory immediately, basically,
Yeah.
because there's improvement after the anesthetic is
Yeah.
gone.
The pain's not there.
Good. I love it. Thank you.
You're welcome.
Well, Lydia, it's the next day. And how are your knees doing?
They're doing great. I feel lighter still.
Let's see you get up and walk to the door. And back and sit down.
It's amazing.
Okay. You're surprised?
I'm happily surprised. It's awesome.
All right. Thanks.
Got up from lying down and was able to reach her knees.
Yep.
And you couldn't do that before?
No.
I just had to help her. She needed assistance before.
Just to get up. And
Just
she got
to
up
get
all
up
by
from a
herself
lying
without
position.
any assistance.
Yeah.
I also want the viewer of this video to see this wound here.
Okay.
That was a carcinoma, squamous cell, you believe, which is a relatively benign cancer.
Right.
They removed that how many years ago?
12.
And I injected that yesterday with ozone, and I've taken some still pictures, and you're telling me it's changed
Color.
or already
Oh, yes.
in one day.
Yes, immediately yesterday it was lighter. It got a little bit darker though,
Yeah.
but it's an improved color.
And you want me to do it again, so
Yes,
we'll do it.
please.
Okay, thank you. All right. I'm impressed that you got up like that.
Yeah.
You know, that's interesting that she did it without thinking. It was just natural,
It was just natural.
natural movement.
Yeah.
Yeah.
And you haven't seen that in a long time.
I can't
No.
remember the last time. You want to do it now?
No, I'm gonna treat you now. Well, Ruth, this is day one. The next day after I did your knees. Let's see you get up and walk. Wow, that was pretty easy. Come on into my office. No cane even. What do you think so far?
Good, very good.
You're happy.
I'm happy.
On a scale of 10, how much pain relief have you had?
On this leg, 5. On this leg, 10.
10 on your left leg.
Mhm.
Wow, thank you. Ruth, it's the 25th. We just did your knees for the second time, and I also did your right ankle because you had a man of war sting there, and you said it screwed up the function of your ankle. I just did it. How do you feel right now?
Much better, much better. The pain has subsided. Yeah,
And the pain in your knee, the right knee,
it subsided also.
how much is left?
I don't feel anything right now.
Oh, that's wonderful.
Yeah.
I'm delighted.
Yeah, I am too.
And your ankle?
Ankle is good too. Yeah.
Any pain left there?
No?
I love it. Thank you.
Thank
I
you.
know you have a long trip back. You've got a 7 or 8 hour ride back to Oregon.
Yes.
And I want to thank your whole family for coming down.
Well, thank you very much, Dr. Rowan. We really appreciate you.
Thanks. Are you surprised by what happened here?
I am surprised.
Okay.
Yes.
Thanks. And you're her niece, right?
I am her niece.
Okay. Thank you.